If there is a mantra that exists in this committee, I think on both sides of the aisle, is that an ounce of prevention is worth more than a pound of cure.
Research shows that 98 million Americans, or 1 in 3, have prediabetes, 75% of Americans are obese, and approximately 129 million people in the U.S. suffer from at least one chronic disease.
We don't know what we're eating or what's in our food.
You can't read labels, you don't understand what you're getting.
We don't have enough research and effort put into discovering why rates in things like obesity and metabolic syndrome are rising.
Obesity as a primary illness is underfunded relative to the societal cost. Just for those who may not know, obesity is implicated in Alzheimer's, implicated in heart disease, implicated in cancer, So although it may not be primary, it is the match that starts the fire for a lot of other diseases.
We're often misguided on how to approach our health and half the time don't know how to take charge of our health.
Patients come in, they have this symptom, and then they're like, okay, this is what's going on, take this prescription or whatever. And, there's not enough time to really focus on, okay, as a patient, what can you do to improve your health here?
So how do we even approach this? Let's start with why. Why are we getting sick? What is the root cause of our disease? This begins within our metabolic health and lifestyle.
Metabolic syndrome, as defined by the National Heart, Lung, and Blood Institute, is a group of conditions that increase risk of heart disease, diabetes, stroke, and so much more.
The 5 characteristics of metabolic syndrome include a large waistline, high blood pressure, high blood sugar levels, high blood triglycerides, and low HDL cholesterol, with the expression of 3 of these 5 diagnosing a patient with metabolic syndrome.
As stated by Senator Cassidy, obesity, but really poor nutrition or metabolic health, is the match that starts the fire, allowing for the development and progression of serious diseases and syndromes such as PCOS, fatty liver disease, heart disease, organ damage, cancer, and more.
We're all vaguely aware that we need to eat well and exercise, but nobody truly knows the extent to which how valuable our health is now in prevention of the disease that may come our way as we grow older.
From what we've seen, especially amongst metabolic disease, what's happening is we're treating the symptoms expressed of a disease or syndrome and neglecting the root cause to why something is happening.
A part of traditional medicine training has sort of gotten very focused on coming up with the name of the diagnosis and then matching that medication or treatment for that diagnosis. And that process works really well in acute care medicine, but with chronic disease management or healthcare, or really working on improving the patient's health, we really need a new way of looking at things.
And the approach that I was receiving as a patient is, we've got to treat the high blood sugar levels. And so the mechanism of action, in that treatment is to give medication that reduce the blood sugar levels, but you're not treating the symptom. You're not treating the cause. The high blood sugar levels is really the symptom. So you take these medications and it's essentially like, removing the sugar from the blood, but keeping it within the body, causing disease and inflammation elsewhere. We're not teaching people how to eat differently. We're not teaching people lifestyle factors that are actually effective at, treating this. And we're just managing the symptoms through medications.
In conventional medicine, as well as in the public, is this confusion between what's the difference between diabetes and insulin resistance. Insulin resistance is a combination of too much insulin produced too often. So the cause of PCOS and obesity and diabetes, so these are 3 cousins, the cause of all 3 is insulin resistance.
Using tools like functional medicine and taking a holistic approach towards patients can aid in our nation's healing and understanding of their body and their health as one whole.
Functional medicine really is just good medicine, right? It is, we're asking that question, why, and looking for the underlying root cause of imbalances in the body. It's very science-based, and it's really focused on the patient as opposed to the diagnosis.
Dr. Jason Fung was talking a lot about reversing type 2 diabetes through mechanisms like intermittent fasting, coupled with low carbohydrate diets, and just really focusing on the root cause, which is the insulin resistance. And if your insulin levels are so high, they're causing disease, then let's correct that.
The toxic additives and ultra-processed foods need to go away. We need to stop falling for the pressures of major pharmaceutical and insurance companies allowing for doctors to over-medicate for profit. And we need to start prioritizing things like lifestyle, metabolic health, and nutrition as our primary medicine when it comes to understanding and approaching chronic disease.
Advocate for further research on benefits of viewing the body as a whole, stray away from over-medication, and strive for prevention over an immediate cure, and allow this information to be taught within our schools and medical schools.